Nature and Scope of Psychology. Welcome to RR's Nursing Zone. In this topic we're going to discuss about the nature and scope of psychology. Definition of psychology. The word psychology is derived from the Greek psyche, mind, soul or spirit, and logos, knowledge, discourse or study. Literally, then, psychology is the study of the mind. Definition of the mind. It is the functional capacity of the brain. Mind is total of various mental processes such as observing, knowing, thinking, reasoning, feeling, wishing, imagining, remembering and judging. History of psychology. Wilhelm Wundt, father of psychology, opened the first psychological laboratory at the University of Leipzig in Germany. Wundt and his co-workers were attempting to investigate the mind through introspection, observing and analyzing the structure of their own conscious mental processes. Methods of psychology and methods of study of behavior. Introspection or self-observation method. The observation method or systemic observation. The experimental method. The survey or inventory method. The test method. The case history or clinical method. The genetic or developmental method. Introspection or self-observation method. Introspect means to look within. It is an internal perception or self-observation. Example, a patient after an operation may be asked to report how he feels. The observation method or systematic observation. It consists of collection of data by means of observing behavior by somebody other than that person. Example, nurse observing the patients to observational report. The experimental method. The experimental method involves the manipulation of variables to establish cause and effect relationships. Example, experiments conducted on people dealing with learning, forgetting and many other mental activities. The survey method or inventory method. This method uses questionnaires, checklists, rating scale, ranking and inventories to assess different aspects of behavior. Example, surveys used to collect political opinion. The test method. Abilities, interests, attitudes and intelligence are measured by this method by making use of carefully devised and standardized tests. Example, intelligence tests, aptitude test. The case history or clinical method. Case studies are in-depth investigations of a single person, group, event or community. Typically, data are gathered from a variety of sources and by using several different methods. Example, case histories are one of the main methods of investigation in abnormal psychology and psychiatry. The genetic or developmental method. It studies the growth of behavior. Example, to understand the learning behavior of an adult, the study will start from his childhood and adolescence. Scope of psychology. Scope of psychology or subfields of psychology. Clinical psychology. Counseling psychology. Social psychology. Experimental psychology. Developmental psychology. Abnormal psychology. Community psychology. Clinical psychology. It is the study of techniques which are employed in the diagnosis and treatment of mentally and emotionally abnormal personalities. Counseling psychology. It is similar to clinical psychology but deals with people with relatively mild personal or emotional problems. Social psychology. It deals with the behavior of an individual as it is influenced by others and how an individual influences others' behavior. Experimental psychology. It involves basic research into the fundamental causes of human behavior by studying such basic processes as learning and memory, sensation, perception and motivation. Developmental psychology. It studies the behavior as it develops from birth, through childhood, adolescence and maturity to old age. Abnormal psychology. It deals with the behavior of individuals who are unusual. Community psychology. It is a broad field where social problems and the attempts of people to adapt to their work and community living. Importance of psychology in nursing. Psychology has become an integral part of every profession including nursing. The study of human behavior is of great value to a nurse in a number of ways. Let's see the importance of psychology and nurse. To understand client, patient. Nurses must understand the patients to provide quality nursing care. The study of psychology helps nurses to understand the individual differences found in behavior and personality traits of the patients and the meaning of their behavior at different circumstances. Understand and help the relatives. Nurses, in the process of providing holistic care, they encourage the relatives and well-wishers to participate in the patient care. It's a challenging task for the nurses to get their cooperation and make them understand why certain actions are performed for the patients. The study of psychology helps nurses to understand the genuine demand of the relatives and concern for the patient. Provide needed advice, guidance and support to the patient. Nurses, by studying psychology, they understand the principles of guidance and counseling and its techniques. Understanding the techniques of guidance and counseling helps nurses to provide individual or group guidance as well as counseling services whenever they need it. Provide quality nursing care. The study of psychology helps nurses to understand the importance of body-mind relationship and apply the principles of psychology in the care of the patients. The knowledge on psychology gives a nurse awareness about the attitude, conflicts, positive thinking, crisis intervention, which in turn helps to provide quality nursing care. Adjust to the professional environment. Nursing is a teamwork and has to work together with other healthcare team members, including her colleagues. She should understand the psychology of people around her to work effectively. She is expected to work in collaboration with other health team members and face the challenges in the professional environment. The knowledge on psychology helps nurses to overcome these challenges in their profession. Understand oneself. The nurse must understand them, that is, her attitude, way of thinking, coping abilities, mental mechanisms, overall strength and weakness. Understanding self helps to adjust to the personal and professional life and to lead a well-balanced life.